morning to you. Matt Hancock,
Hello.
can you hear me? Hello, good morning to you.
Hi.
Hello, lovely to speak to you. So look, life is going to get back to what we're calling the new normal. The Prime Minister has advised us all to use our good, solid British common sense. But a lot of people will be arguing about whether or not it is common sense for us to be coming out of the lockdown. Some would say we should come out of the lockdown straight away in full, and some are very worried about coming out of the lockdown at all. But is this the right time to come out of lockdown, even with these limited measures, when the transmission rate may be only just below 1 in some areas?
Well, we think that it's okay to have some cautious, small baby steps, as the PM called them, and we think that's important. And some of the changes won't have an impact on R at all, but are good common sense, like being able to exercise as many times as you like. If you exercise on your own or with members of your own household, that's a good thing for people's health. So it's very small steps, and then a roadmap to how we might, so long as the virus remains under control, we might be able to take further steps with the dates when we hope to be able to do that. But we're not promising to do that on those dates, because it all depends on the control of the virus.
But a lot of people are saying when it comes to common sense, they think it's a bit strange, and I have to say I'm a bit perplexed by this, that I'm now allowed to drive across the country 2.5 hours to go and see my mother, who's 77 and is shielding herself. I can go and visit her on my own. My husband can't come with me to share the driving there and back, because that would be 2 of us. I can't see her in her garden, because even though it's a nice big garden, if it was sunny, but I can meet her in a park, but my husband can't come with me. And if my mother was still with my father, I couldn't see them both at the same time. I could sit in the car while she saw one, and it's a lot of people are just saying that's not common sense, is it? Why is that all being brought in?
No, it's perfect common sense, and the reason is that large gatherings of people, even half a dozen or more, might cause problems, because outdoors the transmission is much lower, but it is still some risk, and so one person seeing another and spending time together, but 2 meters apart, we think is reasonable and safe. But the problem is that go much further than that, and you're into larger gatherings and the risks associated.
You're into 3 people. I mean, 3 people isn't a large gathering, is it?
No, but we've got to draw a line somewhere, and this is the safest place to draw the line, because it means that people can see each other, albeit at 2 meters and outdoors in a public place, but not then that getting into larger gatherings. Okay. Of course, all these things are judgments, Julia, and this is why it's so important people exercise their common sense, because it's actually the rules are important, but so is how people behave, and that's what really matters for transmitting of the virus. And people have shown such good common sense in the last 6 weeks or so during the full lockdown, and as a result, the NHS was never overwhelmed, and we got the control of the virus, and we brought that R rate down, and we're now seeing fewer new cases. We're seeing far fewer people, thankfully, dying, and this is good news. And it's because people have operated with good sense, and people have done the sensible thing, and we're giving people paying people the compliment of trusting their common sense within a framework that we're setting out. I think everybody knows what social distancing really means, right? It means stay away from other people, wash your hands, keep your surfaces clean, and don't go within 2 meters of people unless you absolutely have to.
And as we know, I agree with you, the vast majority of people, we focus on the people who break the rules, but the vast majority of people, millions and millions of us, have been obeying it. But can you understand why people like Kate, who asked a question to the Prime Minister last night, she's a teacher, she asked why she could go into school and teach children, you could have 15 children in a class, but she couldn't see her own family. A lot of people are confused about people going back to workplaces and people and sending their children back to school, particularly their youngest children, and that being safe, but not being allowed to see mum and dad at the same time. Do you understand why that message is, with all the common sense in the world, pretty confusing?
No, I just don't. And I've spoken to some of my constituents about this, and they completely get it, right? They know what stay alert means. It means stay alert to the virus. It means stay alert to the fact that that we have to behave differently to what we had behaved like before. And they understand things like that because school is important, especially for the little kids, who it's very hard to teach a 5-year-old or a 6-year-old by remote learning. And workplaces do need to get going again. But overall, we've got to keep R below 1. So we can't release all these things at once. We've got to make sure that we try as much as possible to get the economy going, to get things a bit more back to normal, yet at the same time keeping a control of the virus. So that's why there's this balance of things, and they are judgments. And people do make their individual judgments, and thus far have made very smart, very sensible individual judgments to follow the rules. So I think people, honestly, Julia, my honest truth is, I think people really do get it, yes, and they really understand what we're trying to do, and they're playing their part.
Okay, look, yes, I certainly think that the vast majority of people get it far more than the Twitterati have been. I can agree with you on that. But there is still some confusion. There is still some concern, isn't there? For instance, lots of people are concerned about whether they are going to be able to go back to work safely. And there's a duty of care from employers to make sure people can go back to work safely. But there's also a concern about this 2-metre limit. Lots of other countries, it's 1 metre or 1.5 metres. Whether or not people are going to get the right amount of PPE to go to work. Given that we haven't provided all the PPE needed by all the staff in care homes and the NHS, a lot of concern that people feel that their workplaces aren't safe.
Well, it's really important that workplaces are safe. For instance, the provision of PPE in the NHS, which has been an incredibly important part of our operations. I'll agree with you that it's been tough making sure that we get that PPE out to the right places, but that is in the vast majority of cases in place. And absolutely having safe workplaces is very important and a responsibility on employers, and in many cases difficult. This stuff isn't straightforward, but we'll be coming forward with a huge amount more detail on how to make workplaces safe today. We've worked with not only with employers but also with the trade unions, and who last night called what we're coming out with a step forward, which is good, and it's been good working with both the unions and with employers on getting it right. So, nobody's pretending that any of this is easy, but the principles are really clear, and what we're trying to do is translate the principles into balanced judgments about what people can do.
I know we've only got a short time with you, but there's a big concern about both that more infections now in care homes, and the concern that NHS was releasing patients into care homes who were COVID positive, who've been untested, but also that we're not doing enough testing right now. When are we going to get enough testing so we know who's got the virus and who hasn't, and where there are hotspots? And surely we really can't be having more of a lockdown exit until we do know who's got it.
Well, you're right. This, unfortunately, is going to have to be my last answer, and then I'm going to have to go. The testing is incredibly important. We've got over 100,000 tests a day now. I've built that capacity, and with a huge amount of support and help from both the private companies and the public sector and NHS and universities and many, many others. And that testing capacity is important. We're now testing everybody in elderly care homes, both residents and staff, whether they have symptoms or not. We're testing every single one to try to make sure we know where the virus is in care homes. Thankfully, the number of people who are dying in care homes is now falling quite sharply. It's about half what it was at its peak, and that is really good news, but there is much more to do to keep that coming down. Okay. So you're absolutely right about the importance of testing, hence why I made such a big deal of increasing it. And the reason testing is important is for a purpose, which is to get, especially in care homes, in hospital, and actually in the wider population. Okay,
Matt Hancock, Health Secretary, I know you do have to go. Thank you very much indeed for talking to us. Let's just bring in Eric McElroy, listening to all of that. There's always an element of frustration.